Introduction to teeth whitening. Teeth whitening, also known as bleaching, is a popular cosmetic dental procedure that lightens teeth and helps to remove stains and discoloration. The process typically involves applying a bleaching agent to the tooth surface, which then penetrates the enamel to break down chromogens, the compounds responsible for stains. This course will equip you with the knowledge and skills necessary to perform teeth whitening safely and effectively. Adhering to industry best practices, understanding the science behind the procedure, patient assessment, and proper application techniques are crucial for achieving optimal results. We will explore various methods, from in-office treatments to at-home kits, providing a holistic view of the available options. The goal is to ensure you can confidently offer this service while prioritizing client safety and satisfaction. This diploma will certify your proficiency in this specialized area of cosmetic dentistry. The demand for teeth whitening services continues to grow as more individuals seek to enhance their smiles and boost their confidence. As a professional, it is imperative to stay informed about the latest technologies, products, and safety guidelines in this evolving field. This course emphasizes a professional and technical approach, ensuring you understand not just the how, but also the why behind each step of the whitening process. You will learn to identify suitable candidates, manage expectations, and address any concerns that may arise during or after treatment. Our comprehensive curriculum is designed to provide a strong foundation, enabling you to deliver high-quality, reliable teeth whitening services. History and evolution of whitening. The desire for whiter teeth is not a modern phenomenon. Historical records indicate that various methods have been employed for centuries to achieve a brighter smile. Ancient Egyptians used a paste of ground pumice stone and vinegar, while Romans utilized urine, believing its ammonia content could whiten teeth. These early methods, though crude and sometimes harmful, highlight a long-standing human aspiration for improved dental aesthetics. Over time, more sophisticated and less abrasive techniques began to emerge, driven by a growing understanding of dental anatomy and chemistry. The evolution of teeth whitening reflects a continuous quest for both efficacy and safety in cosmetic dental care. The 19th and early 20th centuries saw the introduction of hydrogen peroxide and other acidic solutions, often applied with heat or light, marking a significant step towards modern bleaching. However, these early chemical treatments were often harsh and could cause considerable damage to tooth enamel and gums. The mid-20th century brought about a better understanding of peroxide's mechanism, leading to more controlled and safer applications. The 1980s revolutionized the field with the accidental discovery of carbamide peroxide's whitening properties when used in custom trays for gum treatment. This breakthrough paved the way for the widespread availability of professional and at-home whitening systems we know today, emphasizing gentler, more effective approaches. Whitening techniques overview. Modern teeth whitening encompasses a variety of techniques, each designed to cater to different needs and preferences, offering both in-office and at-home solutions. In-office whitening, often referred to as chairside bleaching, typically involves the application of a high-concentration peroxide gel activated by a light source to achieve rapid and dramatic results. This method is performed under strict professional supervision, ensuring patient safety and maximizing efficacy. The entire procedure usually takes about 1 to 2 hours, making it a convenient option for those seeking immediate improvements. Professionals carefully monitor the process to prevent gum irritation and tooth sensitivity. At-home whitening systems provide a more gradual approach, allowing clients to whiten their teeth in the comfort of their own homes. These systems commonly include custom-fitted trays or pre-filled strips containing lower concentrations of peroxide gels. While results take longer to appear, they can be equally effective over time, offering flexibility and affordability. Whitening pens and toothpastes represent even milder options, primarily targeting surface stains and offering minimal bleaching effects. Regardless of the chosen method, a thorough dental examination and professional guidance are essential to determine the most appropriate and safest approach for each individual. Types of whitening lights. Halogen. Halogen lights were among the earliest light sources used in professional teeth whitening procedures. primarily to accelerate the chemical reaction of peroxide gels. These lights emit a broad spectrum of light, including significant heat, which was believed to enhance the penetration and efficacy of the whitening agent. The heat generated by halogen lamps, however, can be a disadvantage, potentially leading to increased tooth sensitivity and discomfort for the patient during and after the procedure. Despite their historical significance, halogen lights are less commonly used in modern dentistry due to the advent of newer, more advanced light technologies. Their effectiveness was often debated, with some studies suggesting the light's primary role was heat-driven rather than photoactivation. The mechanism behind halogen light activation involved the light energy breaking down the peroxide molecules into free radicals, which then oxidize the chromogens responsible for stains. While this principle remains valid, the excessive heat output made patient comfort a significant concern. Protective measures, such as gum barriers and cooling systems, were often necessary to mitigate these thermal effects. The bulky nature of halogen light units also presented practical challenges in dental offices. As technology advanced, the focus shifted towards light sources that could achieve similar or better results with less heat and greater patient comfort, leading to the decline in halogen light usage in favor of LED and laser systems. Types of whitening lights. LED, light-emitting diode lights, are currently the most widely used light source in professional teeth whitening due to their efficiency, safety, and minimal heat output. Unlike halogen lights, LEDs emit a cool blue light spectrum that is specifically tuned to activate peroxide-based whitening gels without generating significant heat. This reduces the risk of tooth sensitivity and gum irritation, greatly enhancing patient comfort during the procedure. The targeted wavelength as LED light efficiently breaks down hydrogen peroxide or carbamide peroxide into free radicals, accelerating the oxidation process that removes stains. This precise activation allows for more predictable and consistent whitening results. The advantages of LED whitening lights extend beyond patient comfort, encompassing operational benefits for dental professionals as well. LED units are typically more compact, energy efficient, and have a longer lifespan compared to older light technologies, making them a cost-effective choice for clinics. Their cool light emission also means less need for extensive protective measures against heat, simplifying the procedure. Furthermore, many modern LED whitening systems incorporate advanced features such as adjustable intensity settings and built-in timers, allowing for customized treatment plans. The widespread adoption of LED technology has significantly improved the overall experience and outcomes of in-office teeth whitening. Types of whitening lights. Laser. Laser teeth whitening, often referred to as powered bleaching, utilizes a highly concentrated light beam to activate a specialized whitening gel, typically containing hydrogen peroxide. The laser energy precisely targets the chromogenes within the tooth structure, accelerating their breakdown and removal. This method is known for its ability to deliver very rapid and significant whitening results in a single session, often making it a preferred choice for clients seeking immediate dramatic changes. The focused nature of laser light allows for precise application, minimizing exposure to surrounding gum tissues when performed correctly. However, the intensity of laser treatment requires strict professional oversight and protective measures. While highly effective, laser whitening also comes with specific considerations. The intense heat generated by some laser systems can potentially increase tooth sensitivity, similar to halogen lights, although modern lasers often incorporate cooling mechanisms to mitigate this. The cost of laser whitening procedures is generally higher due to the specialized equipment and expertise required. Furthermore, not all clients are suitable candidates for laser whitening, particularly those with pre-existing sensitivity or certain dental conditions. A thorough consultation and assessment are crucial to determine if laser whitening is the appropriate and safest option for an individual, ensuring both efficacy and patient well-being. Types of whitening gels. Peroxide-based. Peroxide-based gels are the gold standard in teeth whitening, with hydrogen peroxide and carbamide peroxide being the two primary active ingredients. Hydrogen peroxide, HP, is a fast-acting agent, typically used in higher concentrations for in-office treatments, delivering rapid results. It directly oxidizes the stain molecules within the teeth structure, breaking them down into smaller, colorless compounds. Due to its potency, HP gels require careful application and professional supervision to protect soft tissues and manage potential sensitivity. Concentrations for professional use can range from 15% to 40%, depending on a specific product and application method. Carbamide peroxide (CP) is a more stable compound that breaks down into hydrogen peroxide and urea when it comes into contact with water. It's commonly used in lower concentrations for at-home whitening systems, such as custom trays or strips. CP releases hydrogen peroxide more slowly, providing a gentler and more sustained whitening effect over a longer period. For example, a 10% carbamide peroxide gel is roughly equivalent to 3.5% hydrogen peroxide. This gradual release makes CP ideal for unsupervised home use, as it minimizes the risk of sensitivity and allows for more comfortable application over several days or weeks. Both HP and CP are highly effective, with the choice depending on the desired speed of results, concentration, and application setting. Types of whitening gels. Non-peroxide. Non-peroxide whitening gels offer an alternative for individuals who may be sensitive to peroxide or prefer a gentler approach to teeth whitening. These gels typically utilize ingredients such as sodium bicarbonate, baking soda, activated charcoal, or various plant-based enzymes to achieve their whitening effect, instead of chemically breaking down intrinsic stains through oxidation. Non-peroxide agents primarily work by physically removing extrinsic surface stains and polishing the tooth enamel. Sodium bicarbonate, for instance, acts as a mild abrasive, scrubbing away surface discoloration. Activated charcoal, known for its absorbent properties, can bind to and lift stains from the tooth surface. While non-peroxide gels are generally considered safer and cause less sensitivity, their whitening efficacy is often limited compared to peroxide-based products. They are most effective at removing superficial stains caused by food, drinks, and tobacco, but may not significantly alter the underlying tooth shade. Plant-based enzymes, such as papain or bromelain, help break down protein pellicle on the tooth surface, which can trap stains. It is important to manage client expectations when recommending non-peroxide options, as the results will be less dramatic and more gradual. These products are often found in whitening toothpastes, mouthwashes, and some over-the-counter kits, providing a maintenance solution rather than a transformative whitening treatment. Professional whitening techniques. Professional teeth whitening, performed in a dental office, offers the most effective and safest way to achieve significant shade improvement. The procedure typically begins with a thorough examination to ensure the client is a suitable candidate and to identify any underlying dental issues. Once cleared, a protective barrier is carefully applied to the gums and soft tissues to prevent irritation from the high-concentration whitening gel. This barrier is crucial for patient safety. A high-strength hydrogen peroxide gel is then applied directly to the tooth surfaces, often activated by a specialized light source like LED or laser to accelerate the chemical reaction. The gel is usually applied in multiple short cycles, with fresh gel reapplied after each cycle. During the in-office treatment, the dental professional closely monitors the client's comfort and the whitening progress. The entire process generally takes about 60 to 90 minutes, resulting in immediate and noticeable shade changes, often several shades lighter. After the final application, the gel is removed and the teeth are rinsed. Post-treatment instructions, including dietary recommendations and advice on managing temporary sensitivity, are provided to ensure optimal long-term results and client comfort. Professional whitening offers superior control over the whitening process, allowing for customized treatment and immediate professional intervention if any issues arise, ensuring both efficacy and safety. At-home whitening techniques. At-home teeth whitening techniques provide a convenient and flexible option for individuals to lighten their teeth gradually over time. These methods typically involve lower concentrations of peroxide-based gels, making them safer for unsupervised use. The most common at-home technique utilizes custom-fitted trays created by a dental professional from an impression of the client's teeth. These trays ensure the whitening gel remains in contact with the teeth while minimizing exposure to the gums, reducing the risk of irritation. Clients apply a small amount of gel into the trays and wear them for a specified duration, usually for a few hours a day or overnight for several days or weeks. Another popular at-home method involves pre-filled whitening strips, which are thin, flexible plastic strips coated with a peroxide-based gel. These strips are applied directly to the teeth and worn for a recommended period, typically 30 minutes, once or twice a day. While less customized than trays, strips offer ease of use and are widely accessible. Whitening pens, which dispense a gel directly onto the teeth, and whitening toothpastes, which contain mild abrasives or low concentrations of peroxide, offer even more convenient but generally less dramatic results. Regardless of the method, consistent use and adherence to instructions are key for achieving noticeable and lasting whitening effects at home. Safety of teeth whitening. The safety of teeth whitening procedures is paramount, and when performed correctly by a trained professional or with proper guidance for at-home use, it is generally considered safe. The primary concern revolves around the active ingredients, typically hydrogen peroxide or carbamide peroxide, and their concentration. High concentrations, used in professional settings, necessitate protective measures such as gum barriers and careful application to prevent chemical burns to soft tissues. Patient assessment is a critical first step to identify any pre-existing conditions that might contraindicate whitening, such as severe gum disease, exposed root surfaces, or extensive dental restorations. A thorough oral examination ensures that the procedure will not exacerbate existing issues or cause undue harm. For at-home whitening, lower concentrations of peroxide gels are used, reducing the risk of adverse reactions. However, misuse, such as prolonged application or using ill-fitting trays, can still lead to gum irritation and increased tooth sensitivity. It is crucial for clients to follow instructions precisely and to consult with a dental professional if any discomfort or unexpected reactions occur. Reputable whitening products undergo rigorous testing to ensure their safety and efficacy. By adhering to established protocols, understanding product limitations, and prioritizing patient health, teeth whitening can be a safe and rewarding cosmetic enhancement. Education on proper technique and potential risks is key to safe practice. Possible side effects. While teeth whitening is generally safe, clients may experience some temporary side effects. The most common side effect is tooth sensitivity, which can manifest as a sharp, fleeting pain when exposed to cold, hot, or sweet stimuli. This sensitivity occurs because the peroxide agents can temporarily dehydrate the tooth and open microscopic tubules in the dentin, allowing external stimuli to reach the nerve. This sensation is usually temporary and subsides within a few hours to a few days after the treatment. Factors such as pre-existing sensitivity, high concentrations of whitening gel, and prolonged application time can increase the likelihood and intensity of this side effect. Proper patient assessment and post-treatment care are crucial for managing and minimizing sensitivity. Another potential side effect is gum irritation, also known as chemical gingivitis. This occurs when the whitening gel comes into direct contact with the soft tissues of the gums, causing redness, soreness, or even mild burning sensations. This is more common with ill-fitting trays in at-home systems or inadequate gum protection during in-office procedures. The irritation is typically localized and resolves quickly once the gel is removed and the gums are rinsed. In rare cases, excessive or improper use of whitening products can lead to more severe issues like enamel erosion or uneven whitening, especially if there are pre-existing dental conditions. It is essential to educate clients about these potential side effects and how to mitigate them. Tooth staining causes. Tooth staining is a common aesthetic concern, and its causes are broadly categorized into extrinsic and intrinsic factors. Extrinsic stains are superficial discolorations that accumulate on the outer surface of the tooth enamel. These stains are primarily caused by the consumption of chromogenic foods and beverages, such as coffee, tea, red wine, and dark-colored berries. Tobacco use, whether smoking or chewing, is another significant contributor to extrinsic staining, often resulting in stubborn yellow or brown discoloration. Poor oral hygiene, leading to plaque and tartar buildup, can also trap stain-causing particles, making teeth appear dull and discolored. Regular brushing, flossing, and professional dental cleanings can effectively manage and remove many extrinsic stains. Intrinsic stains, on the other hand, are deeper discolorations that are incorporated into the tooth structure, either within the enamel or the underlying dentin. These stains are often more challenging to remove with conventional whitening methods. Causes include certain medications, such as tetracycline antibiotics, taken during tooth development, which can lead to permanent gray or brown banding. Excessive fluoride intake during childhood, fluorosis, can cause white spots or brown mottling. Trauma to a tooth can result in internal bleeding and subsequent discoloration. Age also plays a role, as enamel thins over time, revealing the naturally yellower dentin beneath. Understanding these diverse causes is crucial for accurate diagnosis and appropriate treatment planning. Intrinsic versus extrinsic stains. Definition. Understanding the fundamental difference between intrinsic and extrinsic stains is critical for effective teeth whitening treatment planning. Extrinsic stains are superficial discolorations that adhere to the outer surface of the tooth enamel. They are typically caused by external factors that come into contact with the teeth, such as pigments from food, beverages, and tobacco. These stains are often yellow, brown, or black and can usually be removed through professional dental cleaning, scaling, and polishing, or with over-the-counter whitening products that target surface discoloration. They do not involve changes to the internal structure of the tooth. Intrinsic stains, in contrast, are discolorations that are incorporated into the internal structure of the tooth, either within the enamel or more commonly in the underlying dentin. These stains are not simply on the surface, but are embedded within the tooth itself. They result from factors such as certain medications, e.g. tetracycline, excessive fluoride intake during tooth development, fluorosis, trauma, or aging. Intrinsic stains can appear as gray-blue or even deep brown banding and are generally much more resistant to removal by simple cleaning or surface-acting whitening agents. They typically require more potent peroxide-based gels or advanced cosmetic procedures for significant improvement. Expectations for whitening. Setting realistic expectations is crucial for client satisfaction in teeth whitening. While professional whitening can achieve significant improvements, it is important to communicate that results vary greatly among individuals. Factors influencing outcomes include the initial shade of the teeth, the type and severity of staining, and the client's adherence to post-treatment care. Clients should understand that whitening is not a permanent solution. Results typically last from 6 months to 2 years, depending on lifestyle habits and maintenance. Regular touch-ups may be necessary to preserve the desired shade. It is also important to clarify that whitening agents only affect natural tooth structure and will not change the color of existing dental restorations like crowns, veneers, or fillings. Before commencing any whitening treatment, a thorough consultation should address the client's aesthetic goals and explain what can realistically be achieved. Using shade guides to document the starting shade and track progress can help manage expectations visually. Discussing potential side effects, such as temporary sensitivity or gum irritation, also prepares the client for the experience. Emphasize that while a brighter smile is achievable, a Hollywood white shade may not be attainable or even desirable for everyone. The aim is to achieve a natural-looking, brighter smile that complements the client's overall appearance, ensuring they are fully informed and satisfied with the process and its potential outcomes. Anatomy of the tooth. A comprehensive understanding of tooth anatomy is fundamental for safe and effective teeth whitening. The outermost layer of the tooth, the enamel, is the hardest substance in the human body and primarily responsible for protecting the tooth. Enamel is semi-translucent, and its thickness and porosity can influence the tooth's initial shade and how well it responds to whitening. Beneath the enamel lies the dentin, a yellowish, porous tissue that makes up the bulk of the tooth. Dentin contains microscopic tubules that connect to the pulp, and its natural color significantly contributes to the overall shade of the tooth. As enamel thins with age, the yellower dentin becomes more apparent. The innermost part of the tooth is the pulp, which contains nerves, blood vessels, and connective tissue. The pulp is responsible for the tooth's vitality and sensation. During teeth whitening, peroxide agents penetrate the enamel and dentin to reach the chromogens. Understanding the proximity of the pulp and the presence of dentinal tubules helps explain why tooth sensitivity can occur. The cementum covers the root surface below the gum line, and it is generally not exposed during normal whitening procedures. However, if root surfaces are exposed due to gum recession, whitening agents can cause severe sensitivity and should be avoided in those areas. Knowledge of these layers guides proper application and patient protection. Scientific background of tooth whitening. The scientific principle behind teeth whitening primarily involves an oxidation reaction. The active ingredients in whitening gels, typically hydrogen peroxide or carbamide peroxide, penetrate the porous enamel and dentin layers of the tooth. Once inside, these peroxide compounds break down into smaller, unstable molecules called free radicals. These free radicals are highly reactive and seek to stabilize themselves by reacting with other molecules. Their primary targets are the chromogens, which are the large, complex, colored organic molecules responsible for stains embedded within the tooth structure. Chromogens have conjugated double bonds that absorb light, giving them their visible color. When the free radicals encounter these chromogens, they break the double bonds, fragmenting the large, colored molecules into smaller, simpler, and colorless compounds. These smaller molecules no longer absorb light in the visible spectrum, making the tooth appear lighter and brighter. The process is essentially the chemical bleaching action. It does not remove or damage the tooth structure itself, but rather alters the chemical composition of the stain molecules. The effectiveness of the whitening process depends on the concentration of the peroxide, the duration of contact, and the ability of the free radicals to penetrate and react with the chromogens. Understanding this chemical process is key to appreciating how whitening works at a molecular level. Actual whitening versus dehydration. It is crucial to distinguish between actual tooth whitening and temporary tooth dehydration, as both can lead to a lighter appearance immediately after a procedure. Actual whitening, as discussed, involves the chemical oxidation of chromogens within the tooth structure, resulting in a permanent change to the tooth's intrinsic color. This process takes time for the peroxide to penetrate and react, and the results are stable once the tooth rehydrates. Dehydration, however, is a temporary phenomenon that occurs when the tooth loses moisture during the whitening procedure, particularly with in-office treatments that involve heat or prolonged air exposure. A dehydrated tooth appears whiter because the enamel becomes more opaque, reflecting more light. The temporary whiteness caused by dehydration can lead to an overestimation of the final whitening result immediately after the procedure. As the tooth rehydrates over the next 24 to 48 hours, its natural moisture content is restored, and the shade may appear to regress slightly. This color regression is not a loss of actual whitening, but rather the tooth returning to its true post-whitening shade after rehydration. It is important to inform clients about this phenomenon to manage their expectations and prevent disappointment. The true stable whitening result can only be accurately assessed after the tooth has fully rehydrated. Advising clients to avoid chromogenic foods and drinks during this rehydration period is also important to prevent new stains from forming on the temporarily porous enamel. Recognizing dental conditions. Tetracycline. Tetracycline staining is a classic example of severe intrinsic discoloration that presents unique challenges for teeth whitening. This type of stain occurs when tetracycline antibiotics are ingested during tooth development, typically in childhood or during pregnancy. The antibiotic binds with calcium ions and is incorporated into the dentin and enamel, resulting in characteristic gray, blue, or brown bands across the teeth. The severity of the staining depends on the dosage, duration of exposure, and the stage of tooth development. These stains are deeply embedded and are notoriously difficult to remove with conventional external whitening methods, often requiring more aggressive or alternative treatments. When encountering tetracycline-stained teeth, it is crucial to manage client expectations realistically. While some improvement may be achieved with prolonged and intensive professional whitening, complete removal of the discoloration is often not possible. The results can be unpredictable, and the banding may still be visible, albeit lighter. In such cases, alternative cosmetic solutions like veneers or crowns might be more appropriate for achieving a uniform, whiter appearance. Recognizing tetracycline staining involves observing its characteristic horizontal banding and color. A thorough dental history, including medication use during childhood, is essential for accurate diagnosis and guiding the client towards the most suitable treatment plan. Recognizing dental conditions. Fluorosis. Dental fluorosis is another form of intrinsic staining caused by excessive fluoride intake during tooth development, typically before the age of 8. The severity of fluorosis can range from mild, characterized by faint white flecks or streaks on the enamel, to severe, which can manifest as widespread brown stains, pitting, and rough enamel surfaces. While mild fluorosis may not significantly impact aesthetics and can sometimes be masked by whitening, moderate to severe cases present a challenge. The white spots are often more porous than surrounding enamel, and whitening agents can sometimes make these areas appear even whiter, thus accentuating the unevenness rather than blending it. When assessing teeth with fluorosis, it is important to carefully evaluate the extent and severity of the condition. For mild cases, professional whitening might offer some improvement by lightening the overall tooth shade, making the white spots less noticeable. However, for moderate to severe fluorosis, traditional whitening may not be the most effective solution and could potentially worsen the aesthetic outcome. In such instances, alternative cosmetic treatments like microabrasion, resin infiltration, veneers, or crowns might be more appropriate to achieve a uniform and aesthetically pleasing result. Proper diagnosis of fluorosis, based on its characteristic appearance and patient history, is essential for recommending the most suitable treatment plan. Recognizing dental conditions. Exposed roots. Exposed root surfaces, often a result of gum recession, pose a significant contraindication for teeth whitening in the affected areas. Unlike enamel, the root surface is covered by cementum, which is much softer and more porous than enamel. Beneath the cementum lies dentin, which is highly sensitive due to the presence of dentinal tubules that lead directly to the tooth's pulp. When whitening gels come into contact with exposed root surfaces, they can cause severe and prolonged sensitivity, as the peroxide can easily penetrate the dentin and irritate the pulp. Furthermore, cementum can absorb the whitening agent more readily, potentially leading to uneven or blotchy results. It is imperative to identify and protect exposed root surfaces before initiating any whitening procedure. During in-office treatments, a rubber dam or a light-cured gum barrier must be meticulously applied to cover all exposed root areas. For at-home whitening, custom trays should be designed to precisely fit the teeth without extending onto the exposed root surfaces. If a client presents with significant gum recession and exposed roots, it is often advisable to recommend alternative cosmetic treatments or to refer them to a periodontist for gum grafting before considering whitening. Prioritizing patient comfort and preventing irreversible damage to sensitive root areas is paramount for ethical and safe practice. For a non-vital tooth, internal bleaching, also known as non-vital bleaching, is the appropriate treatment. This procedure is performed by a dentist after a root canal treatment has been completed. It involves placing a whitening agent, typically a high-concentration peroxide gel, directly inside the pulp chamber of the tooth, which is then sealed for several days. This allows the bleaching agent to work from the inside out, effectively oxidizing the internal stains. Recognizing a non-vital tooth involves observing its characteristic dark discoloration, often in a single tooth, and confirming its non-vitality through clinical tests and radiographic examination. Referring clients with non-vital teeth to a dentist for internal bleaching is crucial for proper and effective treatment. Recognizing dental conditions. Acid erosion. Acid erosion, also known as erosive tooth wear, is the irreversible loss of tooth structure due to chemical dissolution by acids, not involving bacterial action. This condition can significantly impact the effectiveness and safety of teeth whitening. Common causes of acid erosion include frequent consumption of acidic foods and beverages, for example, citrus fruits, soft drinks, sports drinks, gastroesophageal reflux disease, GERD, and certain eating disorders. Visually, acid erosion can manifest as a smooth, scooped-out appearance on the tooth surfaces, particularly near the gum line, or as a general thinning of the enamel, making the underlying dentin more visible and the teeth appear yellower. The teeth may also appear dull or translucent at the incisal edges. When teeth are affected by acid erosion, the enamel is already compromised, making them more vulnerable to sensitivity and further damage from whitening agents. The increased porosity of eroded enamel can allow deeper penetration of peroxide, potentially leading to severe and prolonged sensitivity. Furthermore, as the dentin is exposed due to significant erosion, direct contact with whitening gels can cause intense pain. It is crucial to identify signs of acid erosion during the initial assessment. Clients with moderate to severe erosion should be advised against teeth whitening until the underlying cause is addressed and the enamel is protected or restored. In mild cases, a very gentle, low-concentration whitening approach might be considered with extreme caution and professional oversight, but often, restorative options are more appropriate. Recognizing dental conditions. Gum disease. Gum disease, ranging from gingivitis, inflammation of the gums, to periodontitis, more severe infection affecting bone and supporting structures, is a significant contraindication for teeth whitening. Inflamed, bleeding, or diseased gums are highly susceptible to irritation from whitening agents. The peroxide gels can exacerbate inflammation, cause chemical burns, and lead to significant discomfort and pain for the client. Furthermore, gum disease often leads to gum recession and exposed root surfaces, which, as previously discussed, are extremely sensitive to whitening agents. Attempting to whiten teeth in the presence of active gum disease can worsen the condition and compromise overall oral health. Before any teeth whitening procedure, a thorough periodontal assessment is essential to ensure the gums are healthy. Signs of gum disease include redness, swelling, bleeding upon probing, tenderness, and gum recession. If any signs of gingivitis or periodontitis are present, the client must be referred to a dentist or periodontist for treatment and resolution of the gum disease before considering teeth whitening. Whitening should only be performed on healthy gums to ensure patient safety and comfort. Prioritizing the client's overall oral health over cosmetic procedures is a fundamental ethical responsibility for any dental professional or aesthetician offering whitening services. A healthy foundation is paramount for successful and safe cosmetic outcomes. Understanding light activation. Light activation in teeth whitening refers to the use of specific light sources to enhance or accelerate the chemical reaction of peroxide-based gels. While the peroxide itself is the primary whitening agent, certain wavelengths of light can provide additional energy to break down the peroxide molecules into highly reactive free radicals more quickly. This acceleration can lead to faster and sometimes more pronounced whitening results, particularly in professional in-office settings. The light source typically used is either LED or laser, each emitting specific wavelengths designed to optimize the gel's performance. It is important to note that the light itself does not whiten teeth. It merely acts as a catalyst for the chemical process. The effectiveness of light activation has been a subject of ongoing research and debate within the dental community. Some studies suggest that the primary benefit of light, especially with halogen systems, was the heat generated, which could dehydrate the tooth and create a temporary whiter appearance, rather than significantly accelerating the chemical reaction. However, modern LED and laser systems are designed to minimize heat while delivering specific wavelengths that genuinely enhance the peroxide's activity. Understanding the role of light as an accelerator, not a direct whitener, is crucial for managing client expectations and explaining the science behind the procedure. Proper light positioning and duration are key to maximizing its catalytic effect while ensuring patient safety and comfort. Client assessment and consultation. A thorough client assessment and consultation are the foundational steps for any successful and safe teeth whitening procedure. This initial stage involves gathering a comprehensive medical and dental history, including any allergies, medications, previous dental treatments, and existing sensitivities. Visual examination of the oral cavity is crucial to identify any contraindications, such as gum disease, exposed roots, extensive restorations, or suspicious lesions. It is also important to assess the client's current tooth shade using a shade guide and discuss their aesthetic goals to determine if whitening is the appropriate treatment. This detailed assessment ensures that the client is a suitable candidate and helps in formulating a personalized treatment plan. During the consultation, it is imperative to educate the client about the whitening process, including the type of gel and light source to be used, the expected duration, and potential side effects like temporary sensitivity or gum irritation. Realistic expectations must be set regarding the achievable shade improvement, emphasizing that results vary and are not permanent. Discussing post-treatment care, dietary restrictions, and the need for touch-ups is also vital for long-term satisfaction. Obtaining informed consent, where the client acknowledges understanding the procedure, risks, and benefits, is a non-negotiable ethical and legal requirement. A well-executed consultation builds trust and ensures a positive client experience.